So I know you're a new wearer, so I'm going to explain to you some of the things that you need, some of the steps that you need to follow prior to the insertion of the contact lenses and what you need to do after. So the first thing that you would need to do is wash your hands thoroughly. And why do we wash our hands? Because we have germs, even when we don't see them, we have germs on our hands and we need to wash them so we don't put the germs in our eyes. So try to use soap and water, mild soap. Try not to use hand sanitizer or sanitizing wipes, because you don't want the chemicals on your eyes. You just want regular, mild soap and water. After you wash your hands, you're gonna dry them with a non-fiber cloth, towel, so you don't have the little fibers on your fingers. After that, you're gonna open your case with the contact lenses, and you're gonna take it with your finger. Try to have your fingers as dry as possible. You're gonna place the contact lens on your index finger, and you're gonna, with a solution, could be BioTrue or Renew multi-purpose contact lens solution. You're gonna drop a few drops on the contact lens so it's wet and clean. Okay, now once it's on your finger, you're gonna inspect for inversion or for damage. There's a few ways to inspect for inversion or damage. You can put it on your index finger and look at it against the light. And if you see the edges are looking outwards, it means it's inverted. You want the edges to look like a bowl. Or you can also pinch them together, fold them together, and if you see the edges touching like a taco, that means it's in the proper way, and if you see the edges outwards, it means it's inverted. You can also see against the light if it has any broken part. You don't want to put any broken contact lens on your eyes. There are a couple ways you can put the contact lenses on your eyes. I usually start with my right eye. I'm going to show you the way I do it, okay? So usually after washing my hands, all the steps that I just told you, you're gonna look down and hold your upper lid, and then with your middle finger, you're gonna hold the lower lid. In this way, even if I want to blink, it's impossible, and that's what you want. You want to hold the eye as strong as you can, so even if you try to blink, the eyes don't close. Okay, and after that, after you have the eye hold, you're gonna look straight ahead, and you're gonna try to keep the opposite eye as open as possible. And with your index finger, you're gonna bring it towards your eye, and you're gonna put it on your eye. Okay. It's normal if the contact lenses falls down or it sticks to your finger. If it sticks to your finger, it means your finger is too wet. You will need to retry it. Or if it sticks, it could mean also that you need to re-wet the contact lens, and after that you can retry it again. Okay, I see here that you're a new wearer, so it's normal to feel discomfort at first. So what we do is that we're gonna put the contact lenses for 4 hours the first day, and then the next day we're gonna add 2 more hours, and the following day we're gonna add 2 more hours, and we're gonna do that for the whole week until we can keep the lenses on for a full day. So I see here that you're a daily wearer, which means that you put the contact lenses on at the beginning of the day and you remove them right before bed or at the end of your day. You also need to get your replacements once a month. Okay, and again, for solutions, I recommend to use any multi-purpose contact lens solution that you can buy over the counter, like Renew, BioTrue. Try avoid buying or using any solution that has like a red cap. Red cap means it cannot touch directly on your eyes, okay? We need to change the solution water each day. We don't want dirty water. On the cap, there's a space for the right lens and a space for the left lens. The right lens goes in the right place, and the left lens goes in the left side. Okay, don't storage them together, and try not to use tap water. Don't use saliva, only the resin solution. It's also important to remember that you will need to replace the contact lens case, after 3 months. For the removal of the contact lens, we're gonna do pretty much the same thing as the insertion. We're gonna look down and we're gonna hold the upper lid. Also, I forgot to mention, before removing, you need to wash your hands as well. You're gonna hold the upper lid as tight as possible, and then you're gonna hold the lower lid, and with dry hands, again, you can look to the side, and with the finger you're gonna move it to the opposite side, and then you can pinch it. Okay, and it's also important to know that it's normal to feel discomfort at first, but if you notice that the discomfort lasts maybe too many hours, just take them off and contact your doctor as soon as possible. And or if you feel redness, itchiness, pain, remove them and contact the doctor. So it's very important to have a backup glasses because we need to let the eyes rest. And also, if you have any questions, please just let me know.